Welcome, everyone, and thank you so much for joining this evening. As many of you know, I'm Dr. Sharice Chambers. I'm a board-certified OBGYN, also known as the period doctor, and I provide medical education on social media, which is what we're going to be doing this evening rather. We're going to be discussing a topic that is super important to my work in sexual and reproductive health. We'll be talking about HIV PrEP, which is pre-exposure prophylaxis, and we'll be specifically discussing if PrEP is right for you. So, quick disclaimer, this session was developed by Vindico Medical Education and the American Academy of HIV Medicine with educational grant support from Gilead Sciences Incorporated. So for more project information, you can view the link in the comments that I posted that took me forever to do right when we started. So let's get started. Hi, Dr. Roll, how are you this evening?
Oh my God, Dr. C, I'm so excited. I've been looking forward to this all day. So much angst and passion. So much for having me on your platform to talk about this. Like,
Absolutely.
My heart.
Yes, no, I'm so excited. I'm going to do a quick intro for you, if that's okay, just for the guests who may not know how wonderfully accomplished you are. So, y'all, this is Dr. Charlotte Page Roll. She's the Director of Research and Operations at Orlando Immunology Center in Orlando, Florida, an adjunct assistant professor of global health at the Emory Rollins School of Public Health in Atlanta, Georgia. And we are so grateful to have an expert, y'all, with us tonight to answer our questions. So we're going to go into a Q&A session. I'm going to ask a few questions that I've prepared, and then we're going to open it up for audience questions. So if you look at the bottom, there is a little question icon. If you click it, you can submit your questions. And what we'll do is once we go through the prepared questions, we will try to answer as many questions as we have in the short 15 minutes that we have. So bear with us. We will do our very best. This is quick, but the conversation is going to continue elsewhere. I'll tell you where to go once we're done. Dr. Roll, are you ready?
Yes.
Wonderful. So first question, can you explain what PrEP is and why it is essential for younger adults to include it in their sexual health strategy?
Absolutely, Dr. C. So PrEP, HIV pre-exposure prophylaxis, what the acronym stands for is not important, right? Really is the use of HIV medications to prevent HIV, all right? And so it's, single antiretrovirals taken by people who know that they don't have HIV, who may risk for HIV. And we know that we have 3 drugs on the market that are super effective at preventing HIV, both in people who are at risk of sexual transmission, and actually one of the options also approved for people who are at risk from injection drug use.
I'm so glad that you emphasize that PrEP is for folks who know they don't have HIV. And I think that's sometimes confused. It's like, hey, if you're taking this medicine, you must have this infection. And that has a lot to do with the stigma around it. But it really says there's so many people who are candidates for PrEP if you really know what the indication for use is, right? So thank you so much for that. Number 2 question, why is it crucial for young women to openly discuss their interest in or need for PrEP with their clinicians?
Oh my gosh, Dr. C, and I'm going to start off by going back to the second part of your first question, that answer, right? And so I don't know if people know, but over 50% of new HIV infections in this country actually occur in people between the ages of 13 to 34. So that's the fastest rising group for new infections. And that's wild when you think about it, because most of us don't think about this for our 14-year-olds, our 15-year-olds. Right? You're in the field of OBGYN. Like, you guys have been working with adolescents for decades. But it's really something new, I think, for us in terms of HIV prevention. And it really is an important group that we have to target. Now, when we're talking about young women, Dr. C, biologically, women actually is easier to acquire HIV compared to so many biological reasons why that is. We don't have enough time to get into it live. But, young women, they're often in situations or relationships where the power dynamics may be a little bit skewed. Yes. Maybe they don't know a lot about the practices of their partner. And I think for this particular group, there are so many times that they do not feel in control of their sexual health and choices made around that. And PrEP is an option that puts the control back into the hands of young. right? And I think that that's so critically important.
I love framing PrEP as something that like gives you control. You know, there's so little that we can't control in this life, and especially when HIV entered into the scene, you know, back in the 80s when things, I mean, people were panicked. The idea, and I think if we could have told people at that time that we would have a medication that could decrease risk so
I,
significantly, I think they would be floored.
I
The other piece that I love that you mentioned is the fastest growing group was 13 to 34. People often dismiss the possibility of any teenager having something like HIV, especially from a sexually acquired scenario. But the reality is, if you are having sex at any age, you could be at risk for this. And so we must talk about all of the ways in which we can protect our adolescents, not just the ways that make us most comfortable, not just the scenarios that seem most probable or most ideal, right? I love that you highlighted that. Thank you so much. Third question, and we're moving right along. I hope you guys are putting your questions in the chat. We're going to get to you soon. I only have 3 more questions. Okay. How do racial disparities affect access to PrEP, and what can be done to address these challenges?
You know, it's a really loaded question.
Yeah.
That question, right? I mean, racial disparities show up, I think, in every facet of medicine, and it's especially disappointing to see it show up in HIV prevention, because we know that racial and ethnic minorities compose the vast majority of new infections, despite the fact they only account for a fraction of the US population. You know, the statistic is so sobering. It's so depressing, right? For those of us who belong to those communities and who went into medicine to actually serve those communities. Like that really is a sobering statistic. And so we see the same thing with PrEP, right? Both PrEP uptake, how PrEP is offered. We know that if you are a Black cis woman, you are less likely to be offered PrEP by your provider compared to if you are a white cis woman or even Hispanic woman. So, you know, we really have to work on some of these issues. You know, it doesn't only come from the PrEP prescriptions, right? It's this whole, again, it's just something that has permeated medicine. It's healthcare access. It's access to insurance. It's those structural barriers that individual practitioners have trouble, you know, battling. Poverty, discrimination, stigma, racism. We can go on and on about why our communities of color are not accessing the healthcare system to even hear about this intervention. Absolutely. Right? It's from both sides. It's a community issue, and then it's also a prescriber issue. Yes. One of the things that I've always said is that from a prescriber issue, we have to get more of us into the workforce. Yes. Right? We really have to do that. You know, you know, I hate to say it, a lot of people are not going into it anymore, much less, you know, folks that look like us, right? And so we really have to come up with innovative strategies. We have to push PrEP not out from the infectious disease realm into the primary care realm, into the OBGYN realm. Yes. Because you know, you guys often have access to these communities that we don't necessarily see in our clinics. And so I think that's one thing we can do from the prescriber standpoint. You know, some of these other issues, the lack of insurance, the lack of access, these are structural barriers, Dr. C. Yes. You know, it really will take a economic and systems-wide change to kind of really tackle some of these. And we can I even really start by talking about Medicaid expansion, which you don't want to get me on that. Okay. Off of that soapbox, right? Right. And some of the states that have not expanded Medicaid, looking at the communities that are disproportionately impacted by HIV in those states, and then stepping back and asking, oh my God, well, why aren't more people on PrEP? Well, there's your answer. Like, right. How are these people supposed to access PrEP, right? And so it really takes kind of starting at the top to really address some of these issues. But I can tell you from a provider standpoint, cultural sensitivity training, yes. And again, more of us into the workforce in any capacity, because the whole healthcare system can be involved in PrEP prescription, right? You don't have to be a provider. You can be a social worker. Yes. Counselor, you can be a PrEP navigator. You know, there's so many pieces to this puzzle, Dr. C, that we can improve upon, and it's hard, it's daunting when you think about it. Things that have to be done. We have to come up with innovative strategies to get PrEP out to the community. Absolutely, and daunting doesn't mean impossible. And I love that you
are realistic about it, but still very optimistic in the opportunities that are there. So one person said Grady loves PrEP, which obviously is here in Atlanta. We offer connection to care in the ER to everyone. So that reiterates your point that it doesn't just have to be an OBGYN provider. It could be someone who sees someone in the ER. You just have to care about it and think about it to be able to present it to your patients.
The whole system has to get involved.
Absolutely.
I agree.
Okay, this is kind of similar to the last question. You touched on this a little bit, but how accessible is PrEP for individuals that don't have insurance or are in low income situations?
Yeah, so that's always an interesting question, Dr. C. And I think it's actually easier than people think, right?
Mm-hmm.
So let's start off with a lot of states have PrEP assistance programs with
Yes.
full coverage for both the medication, the visits,
Mm-hmm.
and their associated labs.
Nice.
There's actually a federal program called Ready Set PrEP
Mm-hmm.
that will provide the 2 oral PrEP options for free to anyone who applies, and that is regardless of income. It's one of the few PrEP applications that does not require information about your income
Love that.
to prove support it, right?
Mm-hmm.
So Ready Set PrEP, federal initiative, one of the efforts to kind of assist in the ending the HIV epidemic, which is again sort of the overall overarching federal initiative that that's a part of. So we have Ready Set PrEP, we have the PrEP assistance programs, and then we also have the manufacturer assistance programs, right?
Mm-hmm.
The that make these drugs have a commitment to make these drugs accessible to those who are on or underinsured. And so there are a variety of mechanisms, Dr. C, to access these drugs. But again, I will acknowledge that a lot of these programs, you can provide the drug, but hey, if someone can't afford to come to the doctor,
Exactly.
or they can't afford follow-up labs, then it kind of is a little bit of a tough situation. There are a lot of health departments that currently have PrEP programs. I know you live in Atlanta.
Yes.
We're helping to start the one at Fulton County Health Department.
Lovely.
We have one at Orange County Health Department here in Orlando as well. And these are great options for people, again, who are on or underinsured.
Thank you so much. I think we have enough time for some audience questions. So I'm just going to see, the first question said, how do we get more women to start PrEP and combat the myth that this is only a gay man's issue? That is such a good question.
Oh my gosh, Dr. C, we made so many mistakes starting, right? We only marketed this to, the gay community. We didn't tell cis women that this was an option for them, and so it started at the beginning, and it's something we kind of working backwards now to correct, right? One of the campaigns that I can think of is a campaign called Reasons Instead of Risk, not reasons, right? And campaign targeting cis women to get away from the idea of HIV risk. Such a word, that's such a negative concept. You must be doing something wrong to need this drug. And instead prioritizing reasons, for someone's personal health, to make someone, to have someone believe that PrEP is a part of their own strategy to prioritize themselves.
Absolutely.
That's
love that,
right? That resonates with women. And so I think more campaigns like, Reasons Instead of Risk, or Risk for Reasons. I can't remember the exact wording. But we need more things that are targeting cis women. And right now we don't have them. So
I can't believe this, but we're out of time. And we had like 6 more questions. Thank you so much for engaging, y'all. I'm so sorry. Time is short. Dr. Roll, thank you for your time and expertise. Viewers, this isn't where the conversation ends. Please follow Dr. Roll to the next segment with Caleb Gossett at 8:15 p.m., so in 1 minute, where they're going to cover current HIV PrEP options, the importance of testing, potential side effects, and PrEP's role in HIV prevention and your sexual health. Lastly, please consider completing our survey about attitudes towards PrEP at the link provided in my stories and in my bio. If you do complete the survey, you could win 1 of 5 $100 Visa gift cards, so that's great. And then finally, thank you for joining us. This live is going to be posted to my Instagram as well as to the Vindico Medical Education's Instagram and YouTube pages. I appreciate you guys so much. Thank you, Dr. Roll. This was wonderfully helpful and educational. Have a great night.
Thanks, Dr. C.
Bye-bye.